Good day, ma'am. I am your student nurse Marmar Cabigas from BSN 1C. Today, I am going to demonstrate to you the proper procedure of giving a complete bed bath to my patient. First, introduce ourselves to our client and verify the client's identity using the agency protocol. Explain to the client what you are going to do, why it is necessary, and how the client can cooperate. Discuss with the client the bath of bathing and explain any unfamiliar procedure to the client. Good day, sir. I am Marmar Cabigas and I will be your nurse for today. May I know about your full name, sir?
I am Richmond Zamora.
When is your birthday?
My birthday is on April 16.
Your age?
I am 19 years old.
So, is it okay that I am going to hold your hand to check for your wristband?
Yes, ma'am.
Okay. So, the procedure that I will be doing, sir, is that we are going to have a complete bed bath. This is done to remove dirt from your body and of course, for you to feel refreshing. Would that be okay with you?
Yes, ma'am.
Okay, thank you. Next is you have to perform hand hygiene and put on our gloves and provide the client's privacy by pulling the bedside curtains or by closing the doors into our patient's room. So, sir, all the doors and windows are now closed to ensure your privacy. Prepare the client and the environment. Make sure that the room is at a comfortable temperature. Offer the patient with the bedpan or urinal or ask whether the client wishes to use a commode or a toilet. Sir, would you like to urinate first?
No.
Okay. Encourage the patient to perform as much a personal self-care as much as possible. During bath, assess each area of the skin appropriately. Prepare the bed and position the client appropriately. So, are you comfortable with your position now, sir?
Yes, ma'am.
Okay. Position the bed at a comfortable working height. Lower the side rail on the other side close to you and keep the other side rail up. Assist the patient to move near you. Place a bath blanket over the top sheet and remove the top sheet under the bath blanket by starting at the client's shoulder and moving the linen down toward the client's feet. Then ask the patient to grasp and hold the top of the bath blanket while moving the linen down to the foot of the bed. Next is you have to remove the client's gown while keeping the client covered with a bath blanket. Place the client's gown in a linen hamper. Make a bath mitt with a washcloth. Wash the face and place a towel under the client's head. Wash the client's eyes with water only and dry them well. Use the separate corner of the washcloth for each eye and wipe from the inner to the outer canthus. I am going to dry your eyes, sir. Ask whether the client wants soap used on the face. So, would you like me to use soap with water or just water, sir?
Just water only, ma'am.
Okay. Wash, rinse, and dry the client's face, ears, and neck. going to rinse your face. I'm going to dry your face. Remove the towel from under the client's head. Next is you have to wash the arms and hands. Place a towel lengthwise under the arm, away from you. Wash, rinse, and dry the arms by elevating the client's arm and supporting the client's wrist and elbow. Use long, firm strokes from wrist and shoulder, including the axillary area. I'm going to rinse it. Going to dry it. Lift your arm for me, sir. I'm going to rinse it. I'm going to dry it. Apply deodorant or powder if desired. Do you want me to apply deodorant or powder to your axillary, sir?
Deodorant only, ma'am.
Okay. Sir, go to the other side. Okay, I am going to wash it. I'm going to rinse. I'm going to dry it. Lift up your arm for me, sir. I'm going to rinse it. Then I am going to dry. So I'm going to apply deodorant. to take its turn. Place a towel on the bed and put a wash basin on it. Place the client's hand on the basin. Place your hands here, sir. And go at the other side. Then next is we have to wash the chest and abdomen. Fold the bath blanket down to the client's pubic area. Lift the bath towel off the chest and bath the chest and abdomen with your mitted hand using a long, firm stroke. Give special attention to the skin under the breast and any skin folds, particularly if the client is overweight. Rinse and dry well. So I'm going to fold your blanket, sir. Going to wash it. Going to rinse. Going to dry it. Replace the bath blanket when the areas have been dried. Next is we have to wash the feet and leg. Expose the leg nearest from you by folding the bath blanket to keep the perineum covered. Lift leg and place a bath towel lengthwise under the client's leg. Wash, rinse, and dry the leg using a long, smooth, firm stroke from the ankle to the knee to the thigh. Okay. I'm going to wash. I'm going to rinse it. Going to dry. I'm going to wash your feet. I'm going to dry. Okay. I'll go at the other side. Okay, I am going to wash it. going to dry. Going to wash your feet. Going to dry it. Next is you have to obtain fresh, warm bath water now or when necessary. Lower the bed when refilling the basin. So I am going to change this water with a fresh and warm bath water. Wash the back and then the perineum. Assist the patient with a prone position. Place a bath towel alongside the back and the buttocks while keeping the client covered with a bath blanket as much as possible. Okay. And I'm going to wash it. Next, I am going to rinse. I am going to dry. Perform a back massage now or after the completion of bath. Okay, I'm going to massage, sir. Okay. Assist the patient to a supine position. So can you position yourself to a supine position, sir? I'm going to take the towel. Determine whether the client can wash the perineal area independently. So, can you wash your perineal area independently, sir?
Yes, ma'am.
Okay. Next is you have to assist the client with grooming aids. So, do you want me, sir, to put a powder or deodorant or lotion on you, sir?
Powder only, ma'am.
Okay. Here. Okay. Help the client to put on a clean gown or pajamas. Okay, I'm going to pull. Assist the client to care for hair, mouth, and nails. Some people prefer or need a mouth care prior to bath. So finally, we can now document the complete bed bath assessment.